If you're over 60 or care for someone who is what you're about to hear might shock you. Imagine faithfully taking a medication every day, believing it's helping your pain, your sleep, your mood, or even your blood sugar, only to find out years later that it's quietly weakening your heart, and you'd have no idea until it's too late. As a heart surgeon with decades of experience, I've sat across from thousands of senior patients who came into my office, complaining of chest discomfort, sudden fatigue, shortness of breath, or strange palpitations. Many were scared. Many had no warning signs. And surprisingly often, the root cause wasn't stress or diet. It was a pill they'd been taking for years. Sometimes that pill was prescribed to help with an entirely different condition. You see, millions of people over the age of 60 take medications daily, many of them for common age-related issues. What they don't realize is that some of these medications taken for years without symptoms can slowly damage the heart. They might increase your blood pressure, disrupt your natural heart rhythm, or even cause your heart muscle to weaken over time. What makes it even more dangerous is that the damage usually happens silently. No chest pain, no flashing warning light, just a slow, invisible decline in heart function until one day it becomes a crisis. In today's video, I'm going to reveal 7 medications that may be quietly harming your heart. These pills are commonly prescribed, widely used, and often taken with full trust, but they come with serious risks that every senior deserves to know. This isn't about creating fear. This is about awareness. If you or a loved one is over 60 and taking medications for pain, sleep, mood, or blood sugar, you need to watch this video until the end. Because pill number 1 is not only the most dangerous, it's also the most commonly used. Now, to be very clear, I am not asking you to stop any medication on your own. Always speak with your healthcare provider before making changes. But you have a right to be informed, so let's begin. Pill number 7. Non-steroidal anti-inflammatory drugs, NSAIDs. Let's start with a group of medications that most seniors are very familiar with: NSAIDs. These include ibuprofen, naproxen, and other over-the-counter drugs often used to relieve arthritis, joint pain, or chronic back pain. They're incredibly common, and many older adults take them almost daily without a second thought. But here's the danger. NSAIDs, when taken regularly, can raise your blood pressure and cause fluid retention. This creates added strain on your heart. For seniors, especially those whose hearts are already aging or weakened, this extra burden can be enough to trigger heart failure or even cause irregular heart rhythms. The risk doesn't stop there. Over time, NSAIDs can damage the lining of blood vessels and impair kidney function, and when the kidneys are compromised, your cardiovascular system is forced to work even harder. Many seniors are already on medications for blood pressure or heart conditions, and these anti-inflammatories can interact silently with those treatments, making them less effective or more dangerous. The real problem is that you won't feel it happening. You might think everything is fine, but inside your heart is under pressure day after day. That's why I always advise my patients to be extremely cautious with over-the-counter painkillers. They may seem harmless, but long-term use, especially without medical supervision, can come with serious consequences. The good news is there are safer alternatives for pain management that don't increase cardiovascular risk. If you've been taking NSAIDs regularly, even just a few times a week, talk to your doctor. Ask whether a safer option might be better for you, because pain relief should never come at the expense of your heart. Now let's move to pill number 6, another one that millions of seniors take, and one that can do even more damage over time. Pill number 6, certain diabetes medications. Thiazolidinediones. If you're managing type 2 diabetes, there's a class of medications you need to be aware of: thiazolidinediones. This group includes drugs like pioglitazone, which are commonly prescribed to lower blood sugar levels. On the surface, they sound helpful, and they do work well for glucose control, but under the surface, they may quietly harm your heart. These medications often cause fluid retention and swelling in the lower legs, especially in older adults. That might seem like a minor side effect at first, but for seniors, particularly those already at risk of cardiovascular disease, this fluid buildup can lead directly to congestive heart failure. What's even more concerning is that these drugs can mask the early signs of heart failure, like persistent fatigue or shortness of breath. You might chalk up your tiredness to aging or your breathlessness to being out of shape when in fact your heart is struggling to keep up under the pressure of excess fluid. Many seniors with diabetes are already at high risk for heart complications. Add in a drug that puts more strain on the cardiovascular system, and you have a dangerous combination. And yet, because these medications are so effective for controlling blood sugar, they're still widely prescribed. So, what should you do if you're over 60 and taking a thiazolidinedione, especially if you've noticed swelling, fatigue, or weight gain? Speak to your healthcare provider. There are other ways to manage blood sugar that don't come with the same heart-related risks. Blood sugar control is important, but it should never come at the cost of your heart. Pill number 5, sleeping pills. Sedative hypnotics. Sleep becomes harder as we age, and many seniors struggle with insomnia. That's why medications like Zolpidem, Ambien, and older sedatives like diazepam, Valium, or temazepam are still commonly used. These drugs are often marketed as safe sleep aids, but the long-term risks, especially for your heart, can be profound. Sedatives slow down your entire central nervous system, including your heart rate and blood pressure. While that might sound relaxing, the reality is it also blunts your body's ability to respond to oxygen demands or sudden stress during sleep. Over time, sedatives can worsen or even cause sleep apnea, a condition where your breathing stops for brief periods while you sleep. This condition puts your heart under intense strain and can lead to serious rhythm disturbances. But it doesn't stop there. Sedatives can interfere with essential heart medications, including beta blockers, reducing their effectiveness. They also increase your risk of falls, confusion, and breathing issues, especially dangerous in older adults who are often on multiple medications. I've had patients who relied on sleeping pills for years, never realizing they were silently harming their heart and brain. If you're struggling with sleep, you're not alone, but there are natural, safer strategies available. Please don't continue any sedative hypnotic medication without discussing it with your doctor, especially if you've been taking it nightly. Poor sleep must be addressed, but not at the cost of your heart and overall health. Pill number 4, tricyclic antidepressants. Finally, let's talk about tricyclic antidepressants such as amitriptyline or nortriptyline. These are older drugs once widely prescribed for depression, anxiety, and even chronic pain. Although they're used less frequently today, millions of seniors are still on them. And they come with serious heart risks. Tricyclics can cause a variety of cardiac complications, including irregular heartbeat, sudden drops in blood pressure, and even heart block, a potentially life-threatening condition where the electrical signals in your heart are disrupted. For seniors, especially those already experiencing arrhythmias or slow heart rates, these medications can be especially dangerous. Even small doses taken regularly can interfere with your heart's rhythm and lead to complications over time. They also increase the risk of dizziness, falls, and cognitive issues, especially in people over 60. That's a combination no senior can afford to overlook. If you or someone you love is taking one of these medications, don't panic, but do have a conversation with your physician. There are newer, safer alternatives available. Just as we discussed the hidden cardiac risks behind older antidepressants, it's equally important to stay alert to medications commonly used for everyday conditions. Because the next pills on our list might be sitting in your medicine cabinet right now, used for things as ordinary as a stuffy nose or acid reflux, but they can quietly strain your heart without warning. Let's keep going with pill number 3. Pill number 3. Decongestants, pseudoephedrine and phenylephrine. When allergy season rolls in, or you're battling a cold, it's natural to reach for quick relief. And for millions of seniors, that relief often comes in the form of decongestants like pseudoephedrine or phenylephrine, 2 ingredients found in many over-the-counter cold and allergy medications. They work by narrowing blood vessels in your nasal passages, making it easier to breathe. Sounds helpful, right? But what many seniors don't realize is that these same medications constrict blood vessels throughout your entire body, not just in your nose. And here's the problem. When blood vessels constrict systemically, your blood pressure rises. Your heart has to work harder. For someone over 60, especially with a heart that's already under stress from age, high blood pressure, or previous conditions, that extra workload can be dangerous. These pills can also trigger palpitations, irregular heartbeats, or make you feel jittery, anxious, or lightheaded, your body's subtle way of saying, something's not right. You might assume that just because it's sold without a prescription, it must be safe. But our bodies change with age. What felt mild in your 40s can become risky in your 60s or 70s. Decongestants can interfere with blood pressure medications and other prescriptions, making management more difficult without you realizing it. So if you're dealing with congestion, always check the label. If it lists pseudoephedrine or phenylephrine, talk to your doctor or pharmacist about alternatives. There are gentler solutions out there, ones that don't quietly burden your heart. Before we move on to pill number 2, here's something urgent that could help you protect your heart every day. A quick note, your heart needs tools too. If you're over 60 and managing medication symptoms or just trying to stay on top of your health, consider downloading the Senior Health Tracker app. It's designed specifically for older adults to log medications, track symptoms, and recognize early warning signs before they become emergencies. Unlike generic health apps, this one is tailored to the unique needs of seniors. Most apps don't account for the complexities of aging, this one does. It's built with larger fonts, simpler interfaces, and built-in medication reminders. Best of all, it can help you have more informed conversations with your doctor. Due to high demand, access is limited this week only, so don't wait. You'll find the download link in the pinned comment and description box below. Stay safe, stay informed, and stay in control. Your heart deserves that much. Now back to the list. Pill number 2, proton pump inhibitors PPIs. You've probably heard of these omeprazole, pantoprazole, and other proton pump inhibitors. They're household names now often used to treat acid reflux heartburn or GERD. Millions of seniors take them every day, often assuming they're completely harmless. But here's the truth. While PPIs are effective at reducing stomach acid, which can bring fast relief from reflux, that acid also plays a vital role in absorbing key nutrients your body desperately needs, especially as you age. One of the most critical is magnesium. Low magnesium can lead to irregular heart rhythms, muscle weakness, fatigue, and even worsen conditions like atrial fibrillation. And because PPIs reduce acid so effectively, they can silently create nutrient deficiencies over time. But that's not all. Long-term PPI use can also disrupt gut bacteria, leading to chronic inflammation, one of the most significant contributors to heart disease. And unlike short-term side effects, this kind of damage builds slowly. You won't feel it right away, but months or years down the line it can show up in serious ways. So what should you do if you've been taking PPIs for more than a few weeks, especially if you're over 60, it's time to reassess. These medications were designed for short-term use, not as lifelong solutions. Chronic heartburn should be evaluated for underlying causes, rather than masked with acid blockers forever. Ask your doctor whether your symptoms might be managed differently, maybe with lifestyle changes, dietary adjustments, or temporary alternatives. Remember, your gut and heart are more connected than you think. When one suffers, so does the other. And now it's time to reveal the final and most dangerous medication on our list, the one prescribed more than any other, and the one quietly weakening senior hearts across the globe. Pill number 1, calcium channel blockers. Calcium channel blockers are commonly prescribed to treat high blood pressure, chest pain, and arrhythmias. Names like verapamil and diltiazem might sound familiar, especially if you or a loved one is managing cardiovascular conditions. In many cases, they are effective at relaxing blood vessels and improving circulation. But in seniors, especially those with already slowed heart function, they can do more harm than good. These medications don't just relax blood vessels, they also slow down your heart rate. For younger, healthier adults, that might be manageable. But for seniors, it can lead to dangerously low heart rates, causing dizziness, extreme fatigue, and even fainting. They can also lead to fluid retention, particularly in the legs, and shortness of breath, which many mistake for simply getting older. Over time, this can evolve into more serious heart rhythm issues. Worse, calcium channel blockers often interact with other medications, and seniors who are typically on multiple prescriptions are more likely to suffer from these complex drug interactions. What's most concerning is that many seniors are prescribed these medications without regular monitoring. When fatigue, swelling, or weakness show up, they're often dismissed as aging, when in fact they're clear signs that the heart is under stress. So, what's the takeaway? If you're taking a calcium channel blocker and feel sluggish, swollen, or have an unusually slow pulse, don't ignore it. These may not be minor symptoms. They could be your heart's way of signaling that something needs to change. But never stop a heart medication on your own. Always consult your doctor. Ask if a newer, safer alternative might work better for you. This pill is powerful, and that's why it demands careful, ongoing supervision. Today, we've walked through 7 commonly used medications, each one potentially helpful, yet each one carrying hidden risks for older hearts. My goal is not to scare you, it's to equip you. If you or someone you care about is over 60 and taking any of the medications we discussed, don't panic. Don't quit cold turkey. But do have a conversation with your doctor. Too often, I've seen seniors end up in the hospital not because of illness, but because of the long-term side effects of their medications. These pills were meant to help, but without monitoring, they can silently harm. Prevention is powerful. With awareness, you can live longer, feel better, and avoid unnecessary risks. And don't forget, tools like the Senior Health Tracker app exist to make this easier. It helps you stay organized, informed, and in control of your treatment journey. Your health is too important to leave to chance. If this video helped you, share it with your loved ones. Subscribe for more advice tailored specifically for seniors, tips that can truly change lives. Until next time, take care of your body, ask questions, and always stay heart strong.